Hello, everyone, and welcome to the Coronavirus Booster for this week of March 22nd, 2021. I'm Elizabeth Demmings, and I'm the Program Coordinator and Extension Specialist at the Institute for Food Safety at Cornell University. Let's take a look at the COVID-19 cases across the U.S. This week. And as you can see, there's an overall downward trend of cases. Hospitalizations are also decreasing across the U.S. However, there are some states where there is an uptick in COVID-19 cases. So it's still really important that we continue to practice these prevention strategies that we've been implementing for the last year. So remember to practice social distancing, wear a face covering, and wash your hands frequently. As cases are going down, we have a uptick in the number of vaccinations that we're doing across the US. And that's thanks to some of these mass vaccination centers in the US, like this one in New York State, which are extremely well organized and efficient at administering vaccines. Almost 45 million people in the US, or 13.5% of the population, are fully vaccinated. And this includes 42.5% of people who are 65 or older, some of our most vulnerable community members. So this is great news. And as more and more people are becoming vaccinated, one of the questions that we're asked the most is, how long does immunity last? And the answer to that is that we just don't know right now, but time will tell. So there are some things that we do know about immunity. And so I just want to dive in to what we do and what we don't know about immunity to COVID-19. So first off, immunity can be achieved through two different ways, either through a natural infection, which means that you actually have to get COVID-19, or it can be induced by the vaccines that are approved for use in the US. And some people might think that if they're infected with COVID-19 and they have natural immunity, that they don't need to get vaccinated. And I want to try to make a case with what we do know about immunity to show you that if you have been infected with COVID-19, you'll still receive benefits from being vaccinated. So the first part is when you have a natural infection, your immune response can really vary, not only from person to person, but also that length of immunity may decrease over time. So right now, we don't know how long immunity will last. The other thing that we're not sure of with natural infection is what factors might influence your immunity. So, for example, if you got sick with COVID-19 and had a severe illness, you could elicit a different type of immune response than if you had a mild illness. The other factor that could impact your immune response is how much of the virus you were exposed to. And so we don't really have that information down. But what we do know with the vaccine is that for individuals who had recovered from COVID-19 and received a dose of the vaccine, that their immune response was boosted significantly. So this is one of the key reasons why if you did have COVID-19, then really a vaccine will benefit your immune response. In addition, we also know that the vaccine-induced immunity, it will either limit or completely prevent the severe disease symptoms, hospitalizations, and death. So this is really one of the most important benefits that you can get from being vaccinated. And then just the final point with immunity from natural infections, we know that reinfection is actually possible, especially with the spread of these new variants. So for example, in Brazil, people who had been infected with COVID-19 became reinfected with the spread of the new variant in that country. What we have in terms of vaccine-induced immunity is that our preliminary evidence is suggesting that you do have some effectiveness against these new variants with the vaccines. Again, this is an area that we're still learning about, but it is a potential benefit from a vaccine-induced immunity. So based on what we do know about immunity is that the vaccine is recommended for all adults, even for adults who have already had COVID-19. We don't know how long immunity is going to last for, but there are definitely some significant benefits to having that vaccine-induced immunity. And so with that, I just want to remind you that there are several benefits to the vaccine, but the vaccine is just one tool in that toolbox of what we're using to fight against this pandemic. And so in addition to getting vaccinated, you still want to practice social distancing, you still want to wash your hands frequently, and you definitely want to continue to wear those face coverings. And with that, I'd just like to acknowledge our funding from the USDA NIFA Agriculture and Food Research Initiative and wish you all a safe and healthy week.